Question 101. What must the nurse emphasize to the family when preparing a child with persistent asthma for discharge? A. A cold, dry environment is desirable. B. Limits should not be placed on the child's behavior. C. The health problem is gone when symptoms subside. D. Medications must be continued even when asymptomatic. The correct answer, D. Medications must be continued even when asymptomatic. Rationale. Children with persistent asthma must continue taking medications to keep them asymptomatic. Inhaled corticosteroids, long-acting beta-2 agonists, and leukotriene modifiers are used as controller medications. Question 102. An older adult with dementia is admitted to a nursing home. The client is confused, agitated, and at times unaware of the presence of others. What is the best nursing approach to help this client adapt to the unit? A. Initiate a program of planned interaction. B. Explain the nature and routines of the unit. C. Explore in depth the reasons for the admission. D. Provide for the continuous presence of a staff member. The correct answer, D. Provide for the continuous presence of a staff member. Rationale. The presence of staff members will give the client support and will provide an opportunity for staff to distract and reassure the client. Continuous supervision is necessary for the safety of the client and others. Question 103. The parents of a child with a fever, headache, and stiff neck express concern that the child be tested for meningitis. Which test should the nurse explain to the parents is used to confirm the diagnosis of meningitis? A. Myelogram. B. Blood culture. C. Lumbar puncture. D. Peripheral skin smear. The correct answer, C. Lumbar puncture. Rationale. A culture of cerebrospinal fluid, CSF, reveals the presence of the causative microorganism, example, pneumococcus, tubercle bacillus, meningococcus, or streptococcus. Question 104. A nurse is caring for a client after a left pneumonectomy for cancer. The nurse palpates the client's trachea routinely. What is the rationale for this nursing intervention? A. A mediastinal shift may have occurred. B. Nodular lesions may demonstrate metastasis. C. Tracheal edema may lead to an obstructed airway. D. The cuff of the endotracheal tube may be overinflated. The correct answer, A. A mediastinal shift may have occurred. Rationale. After a pneumonectomy, the mediastinum may shift toward the remaining lung or the remaining lung may shift toward the empty space, depending on the pressure within the empty space. Either of these shifts will cause the trachea to move from its usual midline position. The trachea is palpated above the suprasternal notch. Question 105. A CBC, urinalysis, and X-ray examination of the chest are ordered for a client before surgery. The client asks why these tests are done. Which is the best reply by the nurse? A. Don't worry, these tests are routine. B. They are done to identify other health risks. C. They determine whether surgery will be safe. D. I don't know, your healthcare provider ordered them. The correct answer, B. They are done to identify other health risks. Rationale. Certain diagnostic tests, example CBC, urinalysis, chest X-ray examination, are done preoperatively to rule out the existence of health problems that may increase the risks involved with surgery. Question 106. A client is scheduled for emergency abdominal surgery. What is the priority preoperative nursing objective when caring for this client? A. Recording accurate vital signs. B. Alleviating the client's anxiety. C. Teaching about early ambulation. D. Maintaining the client's nutritional status. The correct answer, B. Alleviating the client's anxiety. Rationale. Anxiety experienced by a preoperative client can be a disruptive force that may affect the client's ability to cope psychologically and physiologically. Anxiety must be alleviated for other nursing measures to be effective. Question 107. An infant born with hydrocephalus is to be discharged after insertion of a ventriculoperitoneal shunt. Which common complication of this type of surgery should the nurse explain to the parents to prepare them for their child's discharge? A. Violent involuntary muscle contractions. B. Eyes with sclerae visible above the irises. C. Excessive fluid accumulation in the abdomen. D. Fever accompanied by decreased responsiveness. The correct answer, D. Fever accompanied by decreased responsiveness. Rationale. These are associated with infection. This is the greatest postoperative hazard for children with shunts for hydrocephalus. Question 108. Parents are considering a bone marrow transplant for their child who has recurrent leukemia. The parents ask the nurse for clarification about the procedure. What is the best response by the nurse? A. It is rarely performed in children. B. The immune system must be destroyed before a transplant can take place. C. The hematopoietic stem cells are surgically implanted in the bone marrow. D. It is a simple procedure with little preparation needed, and the stem cells are infused as in a blood transfusion. The correct answer, B. The immune system must be destroyed before a transplant can take place. Rationale. An intensive preparatory regimen is needed to destroy the child's immune system. Once the process is started, no rescue therapy except for the transplant is provided. Question 109. What is most important for a nurse to do when helping a new mother on the postpartum unit develop her parenting role? A. Teach her how to care for the infant. B. Provide time for her and her infant to be together. C. Respond to any questions she has about her infant's behavior. D. Demonstrate infant care and evaluate her return demonstration. The correct answer, B. Provide time for her and her infant to be together. Rationale. Parenting can begin only when the infant and the mother get to know each other. To promote development, the nurse should provide time for mother-infant interaction. Question 110. When performing a newborn assessment after a vaginal birth, a nurse observes a swelling on one side of the top of the head. What clinical manifestation did the nurse identify? A. Caput succedaneum that will spread across the scalp and then resolve. B. Fontanelle that bulges when the infant cries and will close in 18 months. C. Cephalohematoma that does not cross the suture line and will resolve in several weeks. D. Molding that results from the skull taking the shape of the vagina and will disappear in several days. The correct answer, C. Cephalohematoma that does not cross the suture line and will resolve in several weeks. Rationale. A cephalohematoma is a collection of blood between the skull bone and its periosteum that results from trauma during birth. It resolves spontaneously in 3 to 6 weeks. Question 111. A healthcare provider prescribes famotidine, Pepcid, for a client with dyspepsia. What is important to include about this medication in a teaching program for this client? A. Lowers the stress level. B. Neutralizes gastric acidity. C. Reduces gastrointestinal peristalsis. D. Decreases secretions in the stomach. The correct answer, D. Decreases secretions in the stomach. Rationale. Famotidine, pepsid, inhibits histamine at H2 receptor sites in the stomach, inhibiting gastric acid secretion. Question 112. Although a nurse is unable to identify any obvious signs or symptoms of bleeding, a client repeatedly has tested positive for occult blood in the stool. Which laboratory result is a concern considering this client's history? A. Iron level 100 micrograms per deciliter. B. Uric acid level 6.5 milligrams per deciliter. C. Hemoglobin level 8.5 grams per deciliter. D. Transferrin level 300 milligrams per deciliter. The correct answer, C. Hemoglobin level 8.5 grams per deciliter. Rationale. Intermittent or continuous loss of a small amount of blood over extended periods will lead to a decreased hemoglobin level. 8.5 grams per deciliter is below the expected hemoglobin range for men, 14 to 18 grams per deciliter, and women, 12 to 16 grams per deciliter. Question 113. A nurse is caring for a client with severe gastritis who vomited a large amount of blood. A lavage is ordered by the healthcare provider. Which response does the nurse expect when using a room temperature irrigating solution? A. Coagulation of blood. B. Neutralization of acids. C. Constriction of blood vessels. D. Stimulation of the vagus nerve. The correct answer, C. Constriction of blood vessels. Rationale. Lavage removes blood from the stomach, and the irrigating solution produces vascular constriction, which helps control bleeding by limiting blood flow to the area. Question 114. A blood transfusion is initiated after a client has had emergency surgery. What should the nurse do first when the client develops fever, chills, and low back pain? A. Notify a healthcare provider. B. Stop the blood and infuse saline. C. Obtain a prescription for an antihistamine. D. Slow the rate of the transfusion and inform the blood bank. The correct answer, B. Stop the blood and infuse saline. Rationale. Fever, chills, and low back pain indicate an acute hemolytic reaction, which is potentially life-threatening. Discontinuing the transfusion immediately limits kidney damage. The vein is kept open by running the primary bottle of normal saline. Question 115. When entering a room, a nurse finds new parents looking at their newborn, who is lying in the bassinet with eyes wide open. What action should the nurse take in response to this infant's behavior? A. Turn on the lights in the room. B. Begin the physical assessment. C. Position the infant on the right side. D. Encourage the parent to talk to the infant. The correct answer, D. Encourage the parent to talk to the infant. Rationale. A quiet, alert state is an optimum time for infant stimulation and interaction with the parent. Question 116. A nurse determines that a postpartum client is gravida 1 and para 1. Her blood type is B negative, and her baby's blood type is O positive. What should the nurse include in the plan of care? A. Type and cross-match blood. B. Obtain an order for RhoGAM. C. Determine the father's blood type. D. Observe for signs of ABO incompatibility. The correct answer, B. Obtain an order for RhoGAM. Rationale. RhoGAM will prevent sensitization from Rh incompatibility that may arise between an Rh negative mother and an Rh positive infant. Question 117. While changing a newborn's diaper, a client expresses concern about a small spot of red vaginal discharge on the diaper. How should the nurse respond to this concern? A. Assess for other signs of bleeding. B. Obtain an order for vaginal cultures. C. Explain that this is an expected finding. D. Apply a urine specimen bag to the perineum. The correct answer, C. Explain that this is an expected finding. Rationale. This is related to the influence of maternal hormones, it is temporary. Question 118. Which clinical findings should the nurse expect when assessing a client with hyperthyroidism? Select all that apply. A. Lethargy. B. Tachycardia. C. Weight gain. D. Constipation. E. Exophthalmos. The correct answer, B, and E. Rationale. B. Tachycardia is associated with hyperthyroidism and is caused by the increase in the basal metabolic rate. E. Exophthalmos is associated with hyperthyroidism and results from accumulation of fluid behind the eyeball. Question 119. What concept of death should a nurse expect a preschool-age child to have? A. Cessation of life. B. Reversible separation. C. Happening that affects old people. D. Someone who takes one away from the family. The correct answer, B. Reversible separation. Rationale. Preschoolers view death as a separation, they believe the deceased will return to life. This is part of their fantasy world. Question 120. A nurse is assessing a client with major depression. Which clinical manifestation reflects a disturbance in affect related to depression? A. Echolalia. B. Delusions. C. Confusion. D. Hopelessness. The correct answer, D. Hopelessness. Rationale. Feelings of hopelessness are symptomatic of depression, the individual feels unable to find any solution to problems and thus feels overwhelmed. Question 121. A client is admitted to the birthing unit in active labor. An amniotomy is performed. What physiologic change does the nurse expect to occur after the procedure? A. Diminished vaginal bleeding. B. Less discomfort with contractions. C. Progressive dilation and effacement. D. Increased maternal and fetal heart rates. The correct answer, C. Progressive dilation and effacement. Rationale. An amniotomy allows for more effective pressure of the fetal head on the cervix, enhancing dilation and effacement. Question 122. A nurse is caring for a client in labor. What client response indicates that the transition phase of labor probably has begun? A. Assumes the lithotomy position. B. Perspires and has a flushed face. C. Indicates back and perineal pain. D. Exhibits decreases in frequency of contractions. The correct answer, B. Perspires and has a flushed face. Rationale. As cervical dilation nears completion, labor is intensified, causing an increase in energy expenditure. These result in perspiration and a flushed face. Question 123. A client with a history of alcohol abuse says to the nurse, "Drinking is a way out of my depression." Which strategy probably is most effective for the client at this time? A self-help group. B. Psychoanalytic therapy. C. A visit with a religious advisor. D. Talking with an alcoholic friend. The correct answer, A. A self-help group. Rationale. Members of self-help groups, particularly Alcoholics Anonymous, are living with the problem themselves, therefore, problem identification and self-responsibility are emphasized, and manipulation is limited. Question 124. A nurse explores with a client who has a history of drug abuse the possibility of joining Narcotics Anonymous, NA. What is a major reason NA is helpful in treating addictive behavior? A. More change will take place within the group. B. Group members are supportive of each other's problems. C. Group members share a common background and history. D. Addiction problems are dealt with more effectively in a group. The correct answer, B. Group members are supportive of each other's problems. Rationale. Although members of the group may become impatient with one another's problems at times, the group usually is supportive. Members share common goals, and the opportunity is available to test out new patterns of behavior. Question 125. A client undergoes cardiac catheterization via the femoral artery because of a history of bilateral mastectomies. What is the most important nursing action after the procedure? A. Provide a bed cradle. B. Check for a pulse deficit. C. Elevate the head of the bed. D. Assess the groin for bleeding. The correct answer, D. Assess the groin for bleeding. Rationale. Most complications after cardiac catheterization involve the puncture site, included are localized hemorrhage and hematomas, as well as thrombosis of the femoral artery. Question 126. A client with heart failure is on a drug regimen of digoxin, lanoxin, and furosemide, Lasix. The client dislikes oranges and bananas. Which fruit should the nurse encourage the client to eat? A. Apples. B. Grapes. C. Apricots. D. Cranberries. The correct answer, C. Apricots. Rationale. Lasix is potassium depleting. Apricots have more than 440 mg of potassium per 100 grams. Question 127. A client in whom sexual dysfunction is diagnosed comments to the nurse, "Well, I guess my sex life is over." What is the most appropriate response by the nurse? A. I'm sorry to hear that. B. Oh, you have a lot of good years left. C. You are concerned about your sex life. D. Have you asked your healthcare provider about that? The correct answer, C. You are concerned about your sex life. Rationale. This explores the meaning of the statement and allows further expression of concern. Question 128. A hospitalized client hurriedly approaches the nurse, saying that it sounds like there is a roaring fire in the bathroom. In reality, the client's roommate has just turned the shower on full force. What term best describes this experience? A. Illusion. B. Delusion. C. Dissociation. D. Hallucination. The correct answer, A. Illusion. Rationale. An illusion is a misperception of an actual stimulus. Question 129. A newborn with acquired herpes simplex virus infection is being discharged. Which developmental pattern is important for the nurse to teach the parents to monitor? A. Visual clarity. B. Renal function. C. Long bone growth. D. Responses to sounds. The correct answer, A. Visual clarity. Rationale. These infants may have retinal dysplasia and other problems that interfere with vision acuity. Ocular disease may not be apparent for several months. Question 130. A healthcare provider prescribes tolterodine, Detrol, for a client with an overactive bladder. What is most important for the nurse to teach the client to do? A. Maintain a strict record of fluid intake and urinary output. B. Chew the extended release capsule thoroughly before swallowing. C. Report episodes of diarrhea or any increase in respiratory secretions. D. Avoid activities requiring alertness until the response to medication is known. The correct answer, D. Avoid activities requiring alertness until the response to medication is known. Rationale. Tolterodine, Detrol, a urinary tract antispasmodic, may cause dizziness and blurred vision, placing the client at risk for injury. Question 131. A nurse is selecting toys for a 5-month-old infant. Which toy should not be given to the infant? A. Large snap beads. B. Soft stuffed animals. C. Rattles that can be held. D. Brightly colored mobiles. The correct answer, A. Large snap beads. Rationale. Fine motor coordination is developed inadequately for manipulation of snap toys. Also, small beads are a choking hazard. Question 132. An infant who was just circumcised is to be discharged with his parents. What should the nurse include in the discharge instructions about post-circumcision care? A. Apply diapers loosely. B. Withhold feedings for 6 hours. C. Cleanse the site with alcohol daily. D. Expect some bleeding for 48 hours. The correct answer, A. Apply diapers loosely. Rationale. Applying the diaper loosely for 2 or 3 days lessens pressure on the penis, thus promoting healing. Question 133. A client in a mental health facility with the diagnosis of bipolar disorder, manic phase, is argumentative, domineering, and exhibitionistic. A visitor reports that this client is running down the hall scaring people. What should the nurse do first? A. Ask the client the reason for running down the hall. B. Approach the client along with several staff members. C. Assess the client's behavior in a non-threatening manner. D. Contact the client's healthcare provider for an order for seclusion. The correct answer, C. Assess the client's behavior in a non-threatening manner. Rationale. The nurse needs to make an assessment, the nurse cannot rely on a visitor's observations. Question 134. A nurse is caring for a 3-year-old child with meningitis. For what signs and symptoms of increased intracranial pressure should the nurse assess the child? Select all that apply. A. Vomiting. B. Headache. C. Irritability. D. Tachypnea. E. Hypotension. The correct answer, A, B, and C. Rationale. Increased intracranial pressure can precipitate vomiting because of its effect on the chemoreceptor trigger zone in the medulla. B. Because the cranial sutures are closed by this age, increased pressure can cause headache. C. Irritability results from increased pressure in the cranium and as a response to related discomforts. Question 135. An older adult is admitted to a nursing home with the diagnosis of dementia. When the nurse is assessing this client's mental status, what question best tests the ability for abstract thinking? A. Can you give me today's complete date? B. How are a television set and a radio alike? C. What would you do if you fell and hurt yourself? D. Can you repeat the following numbers: 8, 3, 7, 1, 5. The correct answer, B. How are a television set and a radio alike? Rationale. This requires the client to find a common characteristic of two things, an ability that is a criterion for abstract thinking. Question 136. A male client receiving hemodialysis undergoes surgery to create an arteriovenous fistula. Before discharge, the nurse discusses care at home with the client and his wife. Which statement by the client's wife indicates that further teaching is required? A. I must touch the shunt several times a day to feel for the brood. B. I have to take his blood pressure every day in the arm with the fistula. C. He will have to be very careful at night not to lie on the arm with the fistula. D. We really should check the fistula every day for signs of redness and swelling. The correct answer, B. I have to take his blood pressure every day in the arm with the fistula. Rationale. Taking the blood pressure in the affected arm may injure the fistula. Question 137. An older adult male with dementia is admitted to a nursing home. His wife appears frail, tired, and angry when she first visits her husband. She remarks to the nurse in a sarcastic tone, "Let's see what you can do with him." What is the nurse's most therapeutic response? A. It has been very difficult to care for him. B. I don't understand what you mean by that comment. C. I know how to care for clients such as your husband. D. It's too bad you didn't get some help to care for him at home. The correct answer, A. It has been very difficult to care for him. Rationale. Acknowledgement of the client's behavior will help lower the spouse's anxiety, reduce guilt, and encourage discussion of feelings. Question 138. A client is admitted to the hospital with a diagnosis of myasthenia gravis. For which common early clinical finding should the nurse assess the client? A. Tearing. B. Blurring. C. Diplopia. D. Nystagmus. The correct answer, C. Diplopia. Rationale. With myasthenia gravis, the sensitivity of the end plates at the postsynaptic junction to acetylcholine is reduced, thus interfering with muscle contraction. Inadequate contraction of the ocular muscles results in double vision, diplopia. Question 139. What should the nurse emphasize when providing discharge instructions for a client with the diagnosis of Addison disease? A. Limit physical activity. B. Restrict sodium in the diet. C. Continue steroid replacement therapy. D. Schedule frequent health care appointments. The correct answer, C. Continue steroid replacement therapy. Rationale. Clients with Addison disease must take glucocorticoids regularly to enable them to adapt physiologically to stress and prevent an Addisonian crisis, a medical emergency similar to shock. Question 140. A hospitalized client is receiving pyridostigmine, mestinon, for control of myasthenia gravis. In the middle of the night, the nurse finds the client weak and barely able to move. Which additional clinical findings support the conclusion that these responses are related to pyridostigmine? Select all that apply. A. Respiratory depression. B. Distension of the bladder. C. Decreased blood pressure. D. Fine tremor of the fingers. E. High-pitched gurgling bowel sounds. The correct answer, A, C, and E. Rationale. A. Anticholinergic effects of pyridostigmine, mestinon, can cause respiratory depression, bronchospasm, laryngospasm, and respiratory arrest, which are life-threatening. C. Anticholinergic effects of pyridostigmine can cause hypotension, tachycardia, bradycardia, dysrhythmias, and cardiac arrest. E. Pyridostigmine is an anticholinergic that increases the peristaltic activity of the intestines. The result is hyperactive bowel sounds. Question 141. A newborn is admitted to the neonatal intensive care unit, NICU, with a myelomeningocele. What is the priority nursing intervention during the first 24 hours? A. Use only disposable diapers. B. Place the infant prone or in a side-lying position. C. Wash the infant's genital area with an anti-infective. D. Perform neurologic checks above or at the site of the lesion. The correct answer, B. Place the infant prone or in a side-lying position. Rationale. This position will prevent pressure on the sac. If the sac ruptures, infection may occur. Question 142. A client with multiple sclerosis is in remission. Which diversional activity should the nurse encourage that best meets the client's needs while in remission? A. Hiking. B. Swimming. C. Computer classes. D. Watching television. The correct answer, B. Swimming. Rationale. Swimming helps keep the muscles supple, without requiring fine motor activity. Question 143. A parent whose newborn infant son has a cleft lip and palate asks the nurse, "How should I feed my baby because he has difficulty sucking?" What information should the nurse provide concerning a safe feeding technique for this infant? A. Since he tires easily, it is best to have him lying in bed while he is being fed. B. He should be held in a horizontal position and fed slowly to avoid aspiration. C. Try using a soft nipple with an enlarged opening so he can get the milk through a chewing motion. D. Give him brief rest periods and frequent burpings during feeding so he can get rid of swallowed air. The correct answer, D. Give him brief rest periods and frequent burpings during feeding so he can get rid of swallowed air. Rationale. The congenital defect prevents the infant from creating a tight seal with the lips to promote sucking. As a result, the infant swallows large amounts of air when feeding. The parent should be taught to provide frequent rest periods and to burp the infant often to expel excess air in the stomach. Question 144. A client at 16 weeks gestation calls the nurse at the prenatal clinic and states that her partner just told her he has genital herpes. A. Condoms must be used when having intercourse. B. Sexual abstinence should be practiced during the last 6 weeks. C. It will be necessary to refrain from sexual contact during pregnancy. D. Meticulous cleaning of the vaginal area after intercourse is essential. The correct answer, B. Sexual abstinence should be practiced during the last 6 weeks. Rationale. Abstinence 4 to 6 weeks before term is the best way to avoid contracting the virus and having an outbreak before the birth. Question 145. Early in the 9th month of pregnancy, a client experiences painless vaginal bleeding and is admitted to the hospital. What should the client's plan of care include? A. Giving vitamin K to promote clotting. B. Performing a rectal examination to assess cervical dilation. C. Administering an enema to prevent contamination during birth. D. Placing her in the semi-Fowler position to increase cervical pressure. The correct answer, D. Placing her in the semi-Fowler position to increase cervical pressure. Rationale. Placing the client in the semi-Fowler position forces the heavy uterus to put pressure on the blood vessels at the site of the separating placenta. This controls bleeding to some extent. Question 146. Which criterion should a nurse use when assessing the gestational age of a preterm infant? A. Simian creases. B. Breast bud size. C. Reflex stability. D. Fingernail length. The correct answer, B. Breast bud size. Rationale. The size of the breast buds is an indication of gestational age. Small, underdeveloped nipples reflect prematurity. Question 147. What client behavior indicates to the nurse that a client with schizophrenia, undifferentiated type, is improving and that the client's plan of care can be updated? A. Stays away from other clients. B. Expresses negative feelings freely. C. Verbalizes better developed delusions. D. Communicates in an organized manner. The correct answer, D. Communicates in an organized manner. Rationale. The presence of loosely associated, tangential thinking is one of the cardinal symptoms of schizophrenia. Its lessening will demonstrate improvement. Question 148. A client who has a diagnosis of paranoid schizophrenia and has been violent in the past is admitted to the psychiatric unit. What should the nurse do before performing an admission interview? A. Move to the client's side and sit down. B. Alert the assault response team about the client's history. C. Have 2 other staff members present when talking with the client. D. Enter the room with another staff member, while remaining between the client and the door. The correct answer, D. Enter the room with another staff member, while remaining between the client and the door. Rationale. This provides safety for the nurse and the other staff member. Placement closer to the door allows for a rapid exit. Question 149. A client at 38 weeks gestation is admitted to the high-risk prenatal unit with a diagnosis of severe preeclampsia. The nurse obtains the vital signs, performs a health history and physical assessment, and reviews the client's laboratory results. What is the priority nursing intervention? A. Monitor intake and output. B. Provide a dark private room. C. Measure the extent of edema. D. Prepare for an immediate cesarean birth. The correct answer, B. Provide a dark private room. Rationale. Increasing cerebral edema may predispose the client to seizures, therefore, stimuli of any kind should be minimized. Question 150. What is the priority when the nurse is establishing a therapeutic environment for a client? A. Providing for the client's safety. B. Accepting the client's individuality. C. Promoting the client's independence. D. Explaining to the client what is being done. The correct answer, A. Providing for the client's safety. Rationale. Safety is the priority before any other intervention is provided.